Thank you, Senator. Thank you, Senator. As you somewhat know, Madam Secretary, I'm a bit Johnny One Note on implementation of the law, especially with respect to sign-ups and exchanges, et cetera, and I'm very concerned that not enough is being done so far. Very concerned. When I'm home, small businesses have no idea what to do, what to expect. They don't know what affordability rules are. They don't know when penalties may apply. They just don't know. I mean, I was talking to one CPA. You know, he's not histrionic. He just being straight with me. He says, Max, I just got to tell you that, you know, my clients, small business people, are just throwing their hands up, and I don't know what to tell them. That's just from a small business perspective, let alone all the other issues that are going to be arising here. And and people, as I discussed earlier, and as you well know, a lot of people have no idea about all of this. People just don't know a lot about it. And the Kaiser poll pointed that out. I understand you've hired a contractor. I'm just worried that that's going to be money down the drain, because contractors like to make money more than they do like to do anything else. That's their job. They got to worry about their shareholders and whatnot, and also all the other agencies are all involved. People are going to be really confused, and maybe give some thought to a one-stop shopping somehow, so you can go to one location, a business person, one location, and get the answers. I just tell you, I just see a huge train wreck coming down, and you and I have discussed this many times, and I don't see any results yet. What can you do to help all these people around the country? What in the world do I do, and what do I know what to do?
Well, Mr. Chairman, as you know, and we have had these discussions a number of times, we certainly take outreach and education very, very seriously. It's one of the reasons that I think we were incredibly disappointed that our requests for additional outreach and education resources were not made available in the CR of 2013. Having said that, we have engaged in efforts with the Small Business Administration, who is doing regular meetings around the country with our regional personnel. We have just released a request for proposal for on-the-ground navigators, individuals who come out of the faith community, out of the business community, out of the patient community, out of the hospital community, who will be available to answer questions, walk people through scenarios, hold seminars. We do regular seminars and webinars, but we also understand that people have a lot of questions, and are deploying as many resources as we can to answer those questions and get folks ready to engage in open enrollment on October 1st.
Well, do you have benchmarks? Do you got dates by which a certain number of people know what's going on? I mean, all these polls, for example, show that we're not making much headway. Do you have a goal that 2 months or 30 days from now, and that same poll is taken, that percentage is down by X percent, and 60 days from now it's down by X, that people know where to go and what to do? Are you surveying the accountants profession, work with businesses, and get a certain percent that or feel confident? I mean, you need data. And do you have any data? You've never given me any data. You just give me concepts, frankly. And government's not a business, but you're going to have some data, benchmarks, to figure out how much progress you are or are not making.
Well, we do not have benchmarks for how many people know what. We don't intend to do polling and testing in terms of what people know. We do have some very specific benchmarks around open enrollment, and we have a campaign and a plan to lead up to open enrollment.
And what is it, the campaign and the plan?
Well, Mr. Chairman, as we have discussed, there will be people on the ground starting this summer.
How many?
Will be, I can't tell you at this point.
And what point in the summer? Geographically, what states? That's the kind of information I'm asking for. You're only going to be able to do a decent job if you know the answers to these questions.
Yes, sir. And I'd be happy to give you all of these specifics. As I said, we just put out the request for proposal. I can't tell you about the numbers because we don't have the information back yet about how many people in which states are going to be actively engaged on the ground, but I will be happy to share that with you as we move forward.
And it depends upon states that have exchanges and those that don't. And there's just a lot of factors here.
We will be focusing, the request for proposal for navigators at this point is on the states where the federal marketplaces will be in place.
What's a navigator?
A navigator is going to be an individual who will go through training and be available. Pardon me?
How many Americans do you think know what a navigator is?
I have no idea.
I'll bet you it's, but, well, we have two here. Okay, you can understand my angst. I'm going to keep on this until I feel a lot better about it. Thank you. Next, Senator Nelson.
Montana Senator Max Baucus, the chair of the Senate Finance Committee, is the Senate's point man on health care reform. Over the past few weeks, he's held a series of hearings on the issue. Senator Baucus has said a national single-payer health care system is off the table, has refused to include any single-payer advocates in the committee hearings. He eventually met with single-payer advocates after a series of protests in which 13 people were arrested after being thrown out of his hearings. However, he expressed no willingness to reverse his principled opposition to a single-payer system that would eliminate for-profit health care. Now, a new article in the Montana Standard finds Senator Baucus has received more campaign money from health and insurance industry interests than any other member of Congress. The article says in the past 6 years, nearly 1/4 of every dime raised by Baucus and his Political Action Committee has come from groups and individuals associated with drug companies, insurers, hospitals, medical supply firms, health service companies, and other health professionals. The article was written by Mike Dennison, a reporter for the Montana Lee newspaper's State Bureau. He writes for 4 daily newspapers in Montana and covers health care closely. He recently interviewed Senator Baucus twice on the issue. He joins us by Democracy Now! Video stream from his home in Helena. Mike, welcome to Democracy Now! Go through the financial support that Senator Baucus gets from the health insurance industry.
We're talking about the health insurance industry and the health industry, which is HMOs, hospitals, physicians, pharmaceutical companies. That's probably where the bulk of his money has come from. The report that we prepared showed out of about almost $15 million he's raised in the last 6 years, both for his campaign and his leadership PAC. 23% of that came from insurance and health interests, and about 18% of that was from the health sector, and a large amount from pharmaceutical, not the companies, but people who work for pharmaceutical companies and pharmaceutical PACs, about $830,000 just from that sector alone. The total amount was about $3.4 million, which we believe is probably more than any other member has received. In terms of the percentage, however, you look at Charles Grassley, the ranking member of the ranking Republican on the Senate Finance Committee, which Baucus chairs. He received 23.5% of his money from the health and insurance sectors during that same time period. And also you look at, for instance, Senator Christopher Dodd from Connecticut, who's been more or less running the Senate Health Committee meetings in the absence of Ted Kennedy. He received about 23% of his funds from the same sectors as well. But in terms of straight dollars, I think Baucus is probably the top dog.
President Obama was confronted recently about Senator Baucus's financial ties to the insurance industry. It was at a town hall meeting in Rio Rancho, New Mexico in mid-May. He was questioned by a local resident, Linda Allison.
My question is, so many people go bankrupt using their credit cards to pay for health care. Why have they taken single payer off the plate? And why is Senator Baucus on the Finance Committee discussing health care when he has received so much money from the pharmaceutical companies? Isn't it a conflict of interest?
If I were starting a system from scratch, then I think that the idea of moving towards a single-payer system could very well make sense. That's the kind of system that you have in most industrialized countries around the world. The only problem is that we're not starting from scratch. We have historically a tradition of employer-based health care. And although there are a lot of people who are not satisfied with their health care, the truth is that the vast majority of people currently get health care from their employers, and you've got this system that's already in place. We don't want a huge disruption as we go into health care reform, where suddenly we're trying to completely reinvent 1/6 of the economy.
That's President Obama not answering the question about Senator Baucus's health insurance financial ties. The resident who asked the question, Linda Allison, says she was partly inspired to raise the point after seeing Democracy Now!'s coverage of single-payer advocates that morning who disputed Baucus's hearing. Have you asked, Mike, Senator Baucus directly about his financial ties to the health insurance industry and the health industry?
Well, I haven't, well, a little bit. We got statements from his office last week about what he has to say about the money he's receiving. And what he said was, well, sure, I've got a lot of money, but we have to raise money, and this is how we do it. And there's many times when I have gone against the health insurance industry and the plans that I'm proposing. And he listed out several times. He said that before, that we're going to have guaranteed issue of health insurance. We're going to squeeze the insurance industry a little bit, but at the same time, they're actually supporting some of these changes because in the bills that are being prepared, everyone's going to be required to buy insurance. It's going to be an individual mandate. And as far as the drug companies and the hospitals, I'm not so sure we have examples there where they're really going to give up too much. What we've asked Senator Baucus is, where are the people who are making all the money from health care going to give? Where is going to be the people who've been profiting, who have to give up something, where? And he has answered us a little bit, but it's not something he comes out and says a lot.
Mike Dennison, what about the constituents? What about Montanans? As we traveled through Montana from Missoula to Helena to Bozeman, there were many healthcare activists who would come out to all the different events. What is the constituency of Montana saying to Senator Baucus?
Well, I went to some of the meetings he had about 3 weeks ago, and there was 20 across the state in various communities. And a lot of the people there at those meetings were saying, why no single payer? Why isn't that being considered at least? And even for the people who weren't single payer advocates, I got the sense the majority of the people at the meetings that I went to and the coverage that I read were saying to Senator Baucus, please give us something that works. Please give us something that addresses the problems out there. Don't just give us a corporate healthcare reform plan.
And how does he respond to his constituents?
Well, the staffers that we saw at these, they're saying, look, we're going to have a public option in the plan, and Senator Baucus is going to fight tooth and nail to get this, to keep the public option in there. A lot of these people are going, what's the public option? We don't know what this is. We don't know what the details are. And we don't know the details yet. And Senator Baucus himself, when we asked him about public options, saying, what is it going to be? He's ambivalent about that and says, look, we'll have a strong public option, but when it comes to details, we just haven't seen them yet. We'll see them in the next couple of days, I guess.
The Washington Post revealed almost 30 key lawmakers helping draft landmark health care legislation have financial holdings in the industry, totaling nearly $11 million worth of personal investments. Senate Majority Leader Harry Reid has at least $50,000 invested in a health care index. Republican Senator Judd Gregg, a senior member of the Health Committee, has up to $560,000 worth of stock holdings in major health care companies, including Bristol Myers Squibb and Merck. The family of Democratic Congresswoman Jane Harman held at least $3.2 million in more than 20 health care companies at the end of last year. Senator Kerry, John Kerry, and his wife, Teresa Hines Kerry, hold at least $5.2 million in companies such as Merck and Eli Lilly. The Senate Health, Education, Labor, and Pensions Committee plans to hold a key hearing today to discuss health care reform. On that 22-member panel, at least 8 senators have financial interests in the health care industry. The hearings will be held by Democratic Senator Chris Dodd, whose wife serves on the boards of 4 health care companies. She received more than $200,000 in salary and stock from her service last year. And Republican Senator Johnny Isakson holds at least $165,000 in pharmaceutical and medical stocks. Democratic Senator Kay Hagan holds at least $180,000 in investments in more than 20 health care companies. Dr. Quentin Young, your comment.
Well, it's appalling, and I think your listeners can see how the republic is in danger. Our congresspeople are paid a huge amount. Not paid. They get donations. What a silly thing that is. And I know there are many in the reform movement who say until we get campaign finance reform, it's going to be hard to pass anything. But I'm particularly pain by Obama, who didn't answer the question that was put to him about the ability of money to corrupt the legislatures. But I think the public is getting wise, and although Mr. Baucus continues to say he won't support hearings even for single payer, there are going to be hearings, and for the first time the single payer movement, of which I'm a proud member, is getting voice. It's just natural that the public would go for it because they have had good experience with public medicine in this country and worldwide, and the time is running out. I think Obama understands this. He's a highly intelligent person. He caved, and I thought it was almost ludicrous when he talked about the good experience that people have had with employee-based insurance. That's one of the most rapidly dwindling sources of health care we have in the country today. People are left out in the cold after decades of union-gained health benefits, and we have to act fast. And I'm hopeful this movement will catch on, and the Congress will become representative of the people's will.
Well, speaking of running out of time, Dr. Quentin Young, thanks for joining us, more than half a century member of the AMA, National Coordinator for Physicians for a National Health Program, and in Helena, Montana. I want to thank Mike Dennison very much for being with us. We'll link to your articles for the Montana Lee Newspaper State Bureau, who's written extensively on health care, and Senator Baucus speaking to us from his home in Helena.
Let me just speak a few minutes. Sorry, order. Leave a recess until order can be restored.
Want a single-payer system. Why do you insist on spending more money when the single-payer would give it to us at the price of spending now? 60%. Why aren't 60% of the people in front of you representing single-payer? 60% of the people want single-payer. This is a sham. All you've got is special interest groups up there.
Going to recess until please come restore order. I'll ask for the please come more expeditiously.
Why aren't single-payer advocates at the table? Healthcare should be for patients, not for profits.
I am Dr. Stephen Fetishel, and it is a sense of outrage that brings me to the Senate chamber. You have been entrusted with doing the people's work, and yet you...
We will stand recess until please come restore order.
The insurance companies, the hospitals for profit.
And I'll say to everybody else out in the audience who may be similarly inclined, believe me, we hear you. I just see a huge train wreck coming down. You and I have discussed this many times, and I don't see any results yet.